Good afternoon. I'm Dr. Les Hall. I'm the interim dean of the School of Medicine. It's my pleasure to welcome you here today. This is a celebratory event, and we want you to enjoy it. This event is about you and someone you love who is about to become a physician. The faculty and I are just here to help you celebrate this tremendous achievement. We will now hear from Greg Blair, who was chosen by his classmates to offer a student welcome. Peer selection to me has always been one of the most special kinds of honors, so please join me in welcoming Greg to the podium.
Thank you, Dean Hall. Ladies, gentlemen, soon-to-be doctors in front of me, welcome to the graduation of the University of Missouri School of Medicine class of 2013. On behalf of our class, I'd like to thank all the families, the friends, the mentors in the audience today, and those who send their best wishes from afar. Thank you for your support, believing in us when we doubted ourselves, and for helping us to achieve our true potential. We wouldn't be here today without you. As I look at my accomplished, incredible classmates and friends in front of me, it's a privilege to see the families and friends here today who played such a direct role in shaping this class. I think we turned out all right. I hope this is as much of a celebration for you all as it is for us. While writing this speech, I'd hoped for a sudden, glorious revelation that would come to me easily. I looked forward to an imaginary epiphany where I would instantly realize exactly what I should say today and exactly how I should say it, hopefully with a few spread your wings and follow your dreams sprinkled in for effect. Unfortunately, this was not the case. Similar to my experience in medical school, writing PBL objectives, studying for impossibly vast exams, and rehearsing speaking points for residency interviews, my speech writing turned into a late-night caffeine-fueled frenzy. I guess some things never do change. I reflected back on my 4 years of experiences and tried to connect a variety of events that didn't seem to have a common connection. How was I supposed to convey the agony of being paged to the OR at 3 a.m. while expressing the joy of solving a PBL test diagnosis? As my mind drifted from med zoo to cooking for my classmates as a PBL quarterback, I gradually saw that it was each of these individual experiences that have molded me into who I am today. Someone who is ready, albeit perhaps a little nervous, to hold a medical degree. The philosopher Lao Tzu once said, "The journey of 1,000 miles begins with a single step." About 4 years ago, we each sat right about where we do now, ready to embark on a long and arduous adventure. We donned a short white coat and excitedly began to imagine what our journey would be like. And about 50 steps into that journey, we realized how painfully short those coats were. 1,000 miles later, we returned to this same space. We've penned out publications, nailed tricky diagnoses, broken sterile field, thrown lupus on the differential diagnosis. But most importantly, we've taken care of patients. As we walk across this stage and receive our diplomas, we will each have 2 little letters after our name with some pretty big implications. More so now than ever, our patients will approach us to seek our medical knowledge and help. Going forward, our observations and decisions will mean more than they ever have before. We will be a direct force in shaping the lives and the outcomes of people who need our help. Of course, there will be moments and situations that will be difficult, such as when we wonder, did I really get all of the medical history from that patient? Did I order the right labs? Is there any way I can possibly cajole cardiology in seriously coming to see my patient? It's during these times that I hope we can all look back on our incredible feats and various experiences from our 4 years and draw strength and confidence from them. Fellow classmates, this sort of reflection is the theme I would like to set for our graduation. As you walk across this stage, reflect on the individual events that have happened and draw strength from them. Remember the late nights and the early mornings studying. Remember the physicians, deans, and teachers, many of whom are seated behind me today and among the audience, who showed you the meaning of caring for a patient and who spent that extra 5 minutes after rounds teaching, trying to convince you why you should be concerned about a sodium level of 127 in an otherwise normal patient. Remember the patients, especially the ones that you got to know well. Many of these people didn't face diseases that were very frightening and unknown to them. Several of these patients did not survive their diagnoses, yet demonstrated powerful strength and resolve in coming to terms with the ends of their lives. Take comfort in knowing that you were there to help comfort and care for those patients, and use those experiences to help you be an even more powerful presence for future patients in similar situations. I also want you to take some time to look to your left and to your right, in front and behind you, and remember the times with your classmates. I know I'm not the only one who sees some of my best friends here. These are the impressive folks that have been down in the trenches with you. These are the people you studied with, celebrated with, dissected cadavers with, commiserated with, most especially before exam week, celebrated with promptly afterwards those exams, and perhaps some of us commiserated again in a slightly different manner the morning after said celebrations. Having spent an incredible past senior week with you all, I rest assured that many of our bonds will last for a very long time, and I hope that you all know that you have a strong support network that will hear your tales of tough night shifts and your heroic feats of finally correcting that low sodium level. Keeping all of these experiences in mind as you walk across the stage, know that another journey of 1,000 miles awaits you as soon as you take your first step outside of Jesse Hall today. We embark on the journey of residency as the next step towards being a practicing physician. I believe that we will practice medicine in a particularly interesting time. It's clear that the practice and delivery of healthcare is rapidly changing and will continue to change, and we need to be leaders, whether that means getting involved nationally or just continuing to be a strong advocate for patients locally in our hospitals and clinic. Knowing our class, we're up to the task. Steve Jobs once said, "You can't connect the dots looking forward, you can only connect them looking backwards." So you have to trust that the dots will somehow connect in your future. You have to trust in something, your gut, destiny, life, karma, whatever. This approach has never let me down, and it's made all the difference in my life. While we remember the events that brought us to this auditorium this afternoon, remember that you survived to this point, and take comfort in knowing that you have the strength to face the challenges ahead. This certainly is the approach that got me through writing this speech, after all. When you doubt yourself, find the supporters who are here today, and as I said earlier, those who can't be here today. They'll put you back on track. On this note, let's take the next step. May your next 1,000 miles be excellent.
Today marks a very special accomplishment of which you can justifiably be very proud. However, you didn't make it to this point alone. I dare say there are some of you here who would not even be here if it weren't for the love, support, money, and cheerleading of others. Today's joys, tears, and feelings of fulfillment are to be shared. They don't belong exclusively to you as graduates. I'd like to ask the class of 2013 to please rise and turn around to face your family and friends. We want to take a moment to acknowledge those whose love, care, and all manner of support were instrumental in your being here today. So as you continue to face your family and friends, would the parents, spouses, and partners of today's graduates please stand? And would the grandparents, brothers, sisters, aunts, uncles, children, and other relatives also please stand so you can be thanked? Thank you. Please be seated. There's another large group of people also deserving of gratitude from our graduates, for without them, no degrees would be awarded today, and they are seated behind me. I'd like to ask the emeritus professors, the faculty, the administration of the School of Medicine, and representatives of University of Missouri Healthcare if they would also please stand. Thank you. Please be seated. I'd like to introduce some very special guests who are seated on the stage with us today. And as I mention these names, I'll ask you to just stand, and then we'll recognize all of them at the end of the introductions. We're privileged to have Brian Foster, the Provost of the University of Missouri, Columbia. Michael Middleton, Deputy Chancellor of the University of Missouri in Columbia. Dr. Hal Williamson, Vice Chancellor for Health Sciences, University of Missouri in Columbia. Dr. William Hines, alumnus of the School of Medicine, class of 1984, and philanthropist. Sally Hauser-Hanfelder, Director of the Harry S. Truman Memorial Veterans Hospital. And we're privileged to have Randy Coyle, the President of the Columbia Chamber of Commerce, with us today. Thank you all. I'd also like for you to meet some of the leaders in the Dean's Office who are responsible for all of the excellent educational programs that have produced what we're celebrating here today, and who will be assisting in today's ceremony. I'd like to introduce Dr. Linda Hedrick, the Helen May Space Distinguished Faculty Scholar and Senior Associate Dean for Education. Dr. Rachel Brown, Associate Dean for Student Programs. Dr. Kimberly Hoffman, Associate Dean for Learning Strategies. And Dr. Jack Gay, Associate Dean for Curricular Improvement. Thank you. Given an opportunity to select a member of the class to address him on this day, the class's of 2013's choice is Kendall Gino. Kendall, will you come forward, please?
It is an honor and a privilege to be here today. Friends, colleagues, thank you. You know, as I was considering what I was going to talk about today, there are just so many things, so many stories that could be told, so many things that we could talk about. One that I remember, I was sitting actually probably in the same exact seat next to Molly Greenwade during our white coat ceremony. And I sat there and I looked up at the stage and I saw actually many of the same faculty and professionals you see before you in their, suits and ties and, all very nicely dressed in dresses and et cetera, et cetera. And then there was one guy up on the stage, seated right in the middle, wearing a Kelly green turtleneck. I mean, just as bright as could be. And I leaned over to Molly, having not known anyone yet, and I leaned over to Molly and said, "Boy, who's the joker in the green turtleneck?" Well, you see, that joker then stood up and introduced himself as Robert Churchill, interim dean of the School of Medicine. Great way to begin a professional career. But the story that I'd like to impart to you today was something that happened to me on my rotations. A doctor who I met that made a profound impact on my life and taught me a couple of things that I wanted to pass on to you, my colleagues. So the rest of you, you're welcome to listen in, of course. But this doctor, we'll call him Dr. Smith as a pseudonym. And he was one of the smartest doctors who I ever worked with, extremely successful in his field. He would treat patients with ease, got along with them very well. People who I would see in his clinic one day who were just almost non-functioning, 2 weeks, 3 weeks later would be back to normal. And I just watched this guy, and I was like, wow, he's a miracle worker. And he knew everything. You know, he could diagnose, he knew the drugs, he knew the interactions of the drugs. He could give you the history on all the drugs even. And I just looked at this man and I thought, holy cow, there is no way I can be a doctor if that's what it takes. There's just no possible way. It's not going to happen. Now, I'd like a show of hands from my classmates here. How many times, or how many of you have had a holy cow, what am I doing here moment? Thank you. Everybody except Andrew Jackson. No, I'm kidding. Sorry. Where are you, Andrew? I love you, man. Sorry. But anyway, I sat there thinking, holy cow, how am I ever going to become like this guy? And you know, one day we were sitting in clinic and he was talking to a particularly challenging patient about something that he needed to treat him for, but the guy was on just a huge list of medications, and essentially he was having problems finding a medication that wouldn't interact with what he was already on. And as I was sitting there just kind of listening to the interaction, I just happened to remember a lecture, a couple that I'd had a few months before, and I was like, you know, there's this medication that I don't think he's talked about yet. Let me think about that, you know, and I thought about it, and I'm like, wait, that might work. So I said, Dr. Smith, what about medication X? And he stopped for a moment. He looked at me, looked up, looked at the patient, said, we'll do that. And of course, you know, I went, oh. And in my mind, I was going, yes! Oh, yes! Yes! You know what I'm talking about, don't you? Yes, every single one of you know that moment. Every single one. Okay. So that brings me to my first point for today. You are well trained. There will come many times there have come many times in the past years, there will come many times in the future where you say to yourself, I can't do this. I'm not smart enough. I'm not good enough. That's not true. Today, when you walk across this stage, you will be given or bestowed a diploma. I don't like that. They will be relinquishing to you something that you have earned with every objective, every PBL test, every knowledge-based exam, every shelf exam, every board exam. You earned it. There is no mistake today that you sit here ready to receive this title of physician. And remember that. Well, so Dr. Smith, was also, he was really successful. He was, in fact, one of the highest paid physicians in his region for his particular specialty. And Dr. Smith liked to talk to me about that, actually. He wasn't a proud guy, don't get me wrong, but that was just kind of his hobby, spending money. You know, that was kind of his hobby. You know, so he'd talk about the hardwood floor that he just put in, or the new deck, or the new car that he bought, and et cetera, and all that was fine and lovely, and you know, I'll admit I began to be a little jealous. I'm like, boy, that's nice. That must be great not to have to worry about that. And I'll be honest, I got a little jealous. He asked me a little bit about myself, and as we talked over the weeks that I was with him, I told him about my wonderful and loving, beautiful, supportive wife, my two amazing foster kids, and my family and my church family and all these things. A few days after that conversation, we were sitting in his office, and he turned to me and just said, you know what, Kendall? I'm really envious of you. And I thought, really? Me? I said, oh? He said, yeah. Because here you are, you have a wife who loves you, foster kids, a family, support. And then he went on to tell me that, you know, he had been divorced for several years. There was a woman who he wanted to marry in his youth, but because through his own admission he had made selfish choices and decided that He wanted to go out and be free and not commit himself or not give his life over to someone else. He had decided not to marry this woman. And then when he had married, he had gotten divorced because he spent too much time in the office, he told me. And he went on, and really frankly, he told me, look, I'm alone. I've got my patients and my money. And he threw himself into his patients, don't get me wrong. He loved his patients, and it showed. And it made a big difference. But he said to me, Kendall, they say money can't make you happy. And he looked at me wryly and he said, it can get you darn close. But, with a little more solemn look, he said, but they're right. You see, because Dr. Smith had learned the hard way the principle that if you live life for yourself alone, you will end up by yourself and alone. And so, as you go forward, Dr. Smith even would say to you today, and me too, don't make the same mistake. You'll have plenty of time to work. You will be stressed out. It will be difficult, la. But remember your significant other, your family, your friends who are here with you. Those who have supported you through these 4 years of medical school will continue to support you. And every minute, I promise you, every minute of time you spend giving of yourself and your time to others will be provided back to you tenfold. I promise you that. And if it doesn't work, you can come hunt me down. But I know you won't. So, ladies and gentlemen, again, thank you so much for the friendship for 4 years, and we will continue that friendship, I am sure. But remember those two things. You are well trained, and don't let anyone tell you otherwise. And live for others, not for yourself. And knowing those two things, may you go on to have that true happiness and success. Thank you.
Thank you. Our invited commencement speaker today is Dr. Ann Havey, who is one of our own. It is unusual for the School of Medicine to invite one of our own faculty or emeritus faculty to be a speaker at the commencement, but I think this choice was particularly brilliant and stunning. And I'm going to actually read her introduction as written by some of the members of the graduating class, which I think makes it even more meaningful. During these short 4 years, there have been many long days. Here at the University of Missouri, the medical students are fortunate enough to have several mentors that help to make these long days more tolerable. An intelligent, kind, approachable teacher is invaluable to a medical student. All of these characteristics can be found in Dr. Havey. Dr. Havey has been inspiring students at University of Missouri School of Medicine for over 31 years. She graduated summa cum laude from Luther College in Decorah, Iowa, with a degree in biology and French, and graduated from medical school at Southern Illinois University. After completing a residency in clinical and anatomic pathology at University of Missouri, she became a faculty member here and thus began her illustrious career of impacting the lives of medical students. The students adored her personality and unique, memorable teaching style, as evidenced by the countless teaching awards that she has received. After hearing about her decision to retire this year, the students were saddened that future classes would not get to know and benefit from her as they did, but those young physicians that she has helped to shape their career through the years will help to carry on her legacy. The class of 2013 wanted a graduation that was memorable and meaningful for them personally. They conducted a national search for a graduation speaker, looking for one who would best inspire, motivate, and excite their class on this great day of celebration. Ultimately, they knew in their hearts who was the perfect choice. Not only does she have a wonderful personality and demeanor, but Dr. Havey is a passionate teacher whose lessons will be ingrained in their minds forever. For all of these reasons, we are pleased to announce her as the graduation speaker for the class of 2013. I am delighted to welcome today's commencement speaker selected by the class to speak to us now.
Class of 2013, Dean Hall, thank you for your generous introduction. It's an honor to speak to you on this joy-filled day. There couldn't have been a better way to culminate my years of teaching than having this experience, so I give you heartfelt thanks. Over the next few minutes, I'd like to reminisce with you a bit, review some of your class's accomplishments over the past 4 years, and finally, I'll end with a few words of advice as you start out in your specialty training. Think back now to your first week at the MU School of Medicine, fall of 2009. Each one of you was one among a class of 96 men and women with remarkably different backgrounds. Some of you had just graduated from college weeks earlier, others had already earned a PhD or RN degree. Some were starting second careers. But at the beginning of Block 1, you found yourselves in a PBL group with 7 strangers, all of whom you probably thought knew more than you did. Not only that, but the presence of the faculty tutor in the room was rather unnerving. Do you remember your first PBL patient? Carla Warren, a 35-year-old with abdominal pain and vaginal bleeding. Seems like a long time ago, doesn't it? Now, to the outside observer, and I'm sure to many of you at the time, PBL seems to be a very inefficient way of learning, at least in the early weeks and months. As you started out reading the patient's clinical signs and symptoms, his medical history, his previous medical history, you found yourselves looking up every 5th word or so in the medical dictionary. Then you received the patient's lab values and were mostly clueless about a low hemoglobin or a high serum calcium. So many of your early objectives were somewhat simple, and in retrospect, sometimes kind of funny, too. How many of you chose an objective such as abdominal pain or anemia, thinking that it was a finite topic, only to recognize that night as you were preparing your objective that it was a huge topic? Do you remember that feeling of initially being overwhelmed? That's no surprise, as it's been estimated that the average medical student learns over 10,000 new medical terms in the first 2 years of medical school alone. The success of our PBL curriculum is in large part dependent on facing those challenges. The challenges include learning new complex basic science and clinical material, presenting it in a distilled, concise, and organized fashion to your peers, and applying what is learned to the PBL patient's problems. The end result, as you all know, is a steady exponential increase in your internal database of knowledge, with the added invaluable skill of being able to integrate information and apply it to the patient's problems. One of you graduating today shared with me a memory from PBL Year 1, quote, "I recall my dynamic and fatherly tutor, Dr. Hasakawa, taking our PBL group under his wing and hosting sushi parties for us, which provided a great break from studying and fostered a real sense of community." That is an example of another strength of our curriculum, continuous student-faculty interaction over the first 2 years. So you survived every hurdle we put before you during Year 1. Who of you could forget that first daunting exam week after Block 1 was completed? You were facing exams unlike any you had ever had before, and it was, in a word, intimidating. But you are all risk takers, and you are all willing to take on challenges, set personal goals, and meet them. I know that because I've seen it, and you've proven it time and time again. On to Block 5 in the fall of 2010, I remember so clearly standing in M105 auditorium introducing the subject of pathology to you. I expressed that from my point of view as a surgical and autopsy pathologist, that there was a fine line between finding something gross and finding something fascinating, and that I was sure you would find the study of disease fascinating. Ultimately, I think during that demanding and intense year, you did find pathology fascinating. Remember the comprehensive Block 5 exam that Dr. Tai assembled, covering a vast amount of material, including normal cell cycle controls, general neoplasia concepts, general genetics, autoimmune disease, and cancer genomics. Once again, every one of you rose to the challenge. Another student in your graduating class recently shared this second-year memory with me, quote, "I strongly believe that I learned more in Block 5 than in any other block in the first 2 years. I recall, Dr. Havey, how you pushed us to find answers on our own, to use the knowledge we already had to find those answers, and to read, read, read. Best advice I've ever received." Then year 2 was over. It was time for step 1 of your licensure exams, another challenge to face. And did you know that your class as a whole scored significantly above the national average on step 1, just as the faculty expected you would? A problem-based learning curriculum simply works. And to my great joy as an educator, it works without squelching your curiosity or your enthusiasm. The School of Medicine faculty took a leap of faith toward major curricular change 20 years ago when we made the transition to PBL. I hope that in future years, each of you can embrace change when it promises potential for a positive and new direction. On to your clinical rotations starting in the summer of 2011. Many of you had no idea of specialty choice as you began your rotations in the various departments: OBGYN, child health, general surgery, general internal medicine, family and community medicine, psychiatry, and neurology. However, about 1 year later, by late last fall, most all of you had made a decision on which specialty to pursue and most likely spend a lifetime practicing. One of you graduating today shared with me this clinical experience that occurred during an international 2-month fellowship in 2012. Quote, "My most memorable med school experience was the opportunity to take care of an elderly Honduran man. We picked him up on the side of the road where he lay covered in his own feces and tangled in barbed wire. He turned out to have a necrotizing pneumonia, ascariasis, chromomycosis, and a seizure disorder. Suffering from schizophrenia, he was estranged from his family. Though he ultimately died after a month in our care, he did so clean, with dignity, and with enough new mental clarity to reconnect with some of his family. It was a medical failure, but a healer's success. What an amazing journey this has been." Now I'd like to spend a few minutes talking about the outside, optional activities that so many of you took part in over the past 4 years. Let me begin with MedZoo. MedZoo Community Health Clinic, for family and friends in the audience, is a student-run, all-volunteer health clinic in operation since 2008. It's funded entirely through grants, donations, and fundraising. and is supervised by 3 volunteer faculty advisors, Dr. Eric Lindblom, Dr. Deborah Howenstein, and Dr. Jola Master from the Department of Family and Community Medicine. MedSoup Clinic has 3 primary goals. The first, provide medical care for the many uninsured patients in Boone County. 2, provide care using an interdisciplinary team approach consisting of students and faculty from medicine, nursing, pharmacy, and social work. And the third objective is to provide effective preventive care. The great majority of you in the class of 2013 took part in this community clinic. And as one of you reminisced recently, quote, "There were so many extraordinary volunteers. MedSou's great renewable resource is the commitment of its student volunteer base, students who have put a huge amount of time into clinic. During the class of 2013's tenure, the clinic grew by leaps and bounds. We doubled MedSou's patient population while expanding patient care by starting 3 specialty nights in addition to our weekly evening clinic. It really was impressive. So kudos to all of you in the class who volunteered and spent precious spare time in order to make the MedSoup Clinic the success that it is today. The School of Medicine faculty and your families are proud of your selfless character and your commitment. 3 of you in the class took an extra year of study, a total of 5 years in medical school, to complete a year of additional training in pathology, called the Post-Sophomore Fellowship Year, and you studied diseases of the body under the microscope, at the autopsy table, or in the microbiology or hematology labs. Your medical training is richer and broader for having spent that year, and you have a depth of understanding that will be invaluable to you regardless of your specialty choice. Other volunteer activities that some of you took part in over the past 4 years were medical trips to Central America and Mexico. The annual SITE trip, which stands for Students Interested in Global Health Tomorrow, is a medical mission to Tecolutla in the state of Veracruz, Mexico. 14 students in your class took part over the past 4 years, seeing patients in a rural community to treat basic medical diseases and deparasitize children, do health screenings and referrals under the direction of 3 Mexican physicians. 2 of you in the class have just returned from a medical trip to Chichicastenango, Guatemala, sponsored by the Mizzou Christian Medical and Dental Association. The team included M1s, M2s, M4s, pharmacy students, a pharmacist, and 2 MU alumni, Drs. Julia Halsey and James Walton, who served as the team physicians. This MU team provided medical care for the indigent native Quiche population in rural Guatemala. Your class's extracurricular involvement, volunteer work, demonstrates an important quality that will be invaluable throughout your medical careers, and that quality is leadership. Dr. Wiley Suba, Dean of the Dartmouth Medical School, defines it this way. Leadership, this is a quote, leadership defines what the future should look like, aligns people with that vision, and inspires them to make it happen despite obstacles. As you finish your residency training and enter private group or academic practice, you'll have many opportunities to take leadership roles in your respective communities. These roles will range from serving on local boards such as Habitat for Humanity, United Way, Public School Board, to serving on a medical school admissions or curriculum committee. Regardless of your leadership role, the rewards will be the positive results that you and others achieve, as well as the personal joy and self-respect gained from knowing that you have made a difference. And finally, a few words of advice from several of my colleagues and friends who have been in medical practice for over 3 decades. I asked each of them to sum up in just a few sentences pearls of wisdom as you begin your medical careers. The first from an ER physician: live in the moment. Try to avoid the trap of postponing happiness until a later date, as in, I'll be happy when this residency is over, or when my mortgage is paid, or when the kids are grown. Another way to say this is, make an effort to be consciously aware of the positive things in your life day by day by day. The second pearl from a pulmonary physician: the astute clinician should be confident in his or her diagnosis in order to instill trust in the patient. However, one must always be prepared to reassess the diagnosis as the clinical picture evolves. And to that advice, I'd like to add my own personal caveat by saying, if you are diagnosing and treating a patient with a rare disease or an atypical presentation of disease, don't hesitate to get a second opinion from a colleague or from a specialist in the field. This is not a sign of weakness. It is a sign of strength and recognition that none of us can always be right. The third pearl from a general internist: recognize the vital importance of empathy. Try to understand the patient's perspectives, his fears, his challenges, his comforts. Careful listening, being attentive, and in the moment are underappreciated clinical skills. There will be times when empathy shown through careful listening turns out to be the patient's best therapy. The fourth pearl from a radiologist: today you have earned the privilege of graduating from the MU School of Medicine, but it is not an entitlement. Let your position and medical training be put to its best use by providing excellent care for your patients, interacting effectively with your peers, and teaching your students. This will bring you personal fulfillment. The fifth and final pearl comes from me. Make a conscious effort to maintain some kind of equilibrium in your lives. You will be pulled in multiple directions, solving patient care problems, responding to a busy call schedule, dealing with staff conflicts, not to mention staying up to date in your fields. If you add time with family into the daily equation, as so many of you already have, it becomes more complicated. But it is possible to do both well. Notice I didn't say perfectly. It doesn't have to be perfect, but you can do it well. First of all, don't hesitate to get outside help. Set family or partner priorities. Establish routines such as eating supper certain nights of the week together or reserving Sunday afternoon for family. This consistency in making time for family will bring its own incalculable rewards. You will be less stressed and guilt-ridden when you are at work, and your family dynamic will be healthier. I remember so well the days 20 years ago when the PBL curriculum was just being developed, and I was being pulled between writing new PBL cases, reviewing and signing out surgical pathology cases, and family responsibilities. Believe me, there were very few home-cooked meals during those years, but my husband had a great attitude. I remember him saying, "What difference does it make if we're eating out again tonight? We're eating together as a family." And he was right. So of course it helps tremendously if you have a supportive and flexible partner. Class of 2013, today is a day of reflection, of celebration, excitement, anticipation, and hope. Each of you has successfully met numerous challenges over the past 4 years, and there will be many more. The MU School of Medicine faculty and I are proud of your accomplishments, and we fully expect you to continue your pattern of success and leadership in the years to come. Congratulations.
Thank you, Dr. Havey. The general public undoubtedly thinks first of the Hippocratic Oath at medical school graduation, but there are other similar oaths that are also administered. Many feel that the wordings of these alternative oaths are preferable because they are more contemporary. At the University of Missouri School of Medicine, we ask our graduating classes to select the oath that they would like to take, and for many, many years, MU seniors have selected the Oath of Geneva. This oath is printed on the back of the commencement program. Because of the solemnity of this moment, I would ask the platform party and the audience, as well as the students, to rise and follow along as I administer the Oath of Geneva to the class of 2013. I would ask the students to repeat each phrase after I say the phrase. At the time of being admitted as a member of the medical profession, I solemnly pledge to consecrate my life to the service of humanity. I will give to my teachers the respect and gratitude that is their due. I will practice my profession with conscience and dignity. The health of my patient will be my first consideration. I will respect the secrets that are confided in me even after the patient has died. I will maintain by all means in my power the honor and the noble traditions of the medical profession. My colleagues will be my sisters and brothers. I will not permit considerations of age, disease, or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient.
I will not permit considerations of age, disease, or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient.
I will maintain the utmost respect for human life. I will not use my medical knowledge to violate human rights and civil liberties, even under threat.
I will not use my medical knowledge to violate human rights and civil liberties, even under threat.
I make these promises solemnly, freely, and upon my honor.
I make these promises solemnly, freely, and upon my honor.
Thank you.
Good afternoon. We're nearing the time in this ceremony in which each graduate will be recognized. One by one, members of the class of 2013 will come to the stage to receive the doctoral hood. And yes, indeed, we will relinquish to each of you your Doctor of Medicine degree, which you've so well earned. I want to say a couple words about the hood, and then introduce to you the people that the class has honored by naming them as investiture marshals this year. The wearing a hood as part of academic regalia signifies the achievement of the doctoral degree. The color of the velvet on the outside of the hood that our graduates will receive represents the degree that they have earned, in this case, green for medicine. In addition, the silk lining shows the colors of the school from which the wearer has received the degree. Therefore, members of the class of 2013 will receive hoods with a black and gold lining, matching the ones worn by members of the faculty on stage with us today who are proud alumni of this school. Each year, the graduating class honors members of the faculty by electing them as investiture marshals to assist in the donning of the doctoral hoods. So it is my honor to introduce this year's investiture marshals. First, Dr. Mark Beard. Please stand. Dr. Beard is Assistant Professor of Family Medicine, and he is one of these proud alumni with a black and gold hood on today. Dr. Beard has been a member of the faculty since 2009, and he's clearly a rising star as a medical education leader. He's already been recognized with many awards, including 4 presented at the Honors and Awards Convocation yesterday. The students basically wouldn't let him sit down. He, as a resident, was already recognized for his teaching excellence as the students elected him to membership in Alpha Omega Alpha, or AOA, the Medical Honor Society. As a faculty member, he's received Curriculum Board Awards for excellence as a block director and for curricular innovation. He's received 2 Golden Apple Teaching Awards, the Student Mentor Award, the Sandra McCurdy Dedicated Staff Award for outstanding service to the school, the Paul C.J. Sun, M.D. Distinguished Faculty Award, the Robert N. McCallum Student Advocacy Award 3 times, and the Humanism and Medicine Award. Congratulations, Dr. Beard. Next is Dr. Ghassan Hammoud. Dr. Hammoud is Associate Professor of Medicine, specializing in gastroenterology and advanced endoscopy. After Dr. Hammoud joined the MU School of Medicine faculty in 2008, he immediately became famous for his teaching excellence, especially his do not miss lectures. He also has received numerous awards, including 2 yesterday, 1 each for excellence in preclinical and clinical teaching, so across the whole spectrum of undergraduate medical education. He was elected as a faculty member to AOA. He's received 2 Curriculum Board Awards for Outstanding Lecturer and the Curriculum Board Citation of Merit Award. He's received 3 Golden Apple Awards and twice has been nominated by MU students for the American Medical Student Association's National Golden Apple Award. The Medical Student Affairs Council has given Dr. Hammoud its Excellence in Clinical Education Award, and 5 times he's received the Medical Student Affairs Council Excellence in Preclinical Education Award. Congratulations, Dr. Hammoud. Dr. William Salzer. Dr. Salzer is Professor of Clinical Medicine, specializing in infectious disease. He joined MU as a faculty member almost 21 years ago, and he's provided over that time leadership in multiple capacities, including serving as a PBL block director since 1993. That means he was one of the original PBL block directors. Dr. Salzer has received many accolades for his medical student teaching, including election to AOA as a faculty member, 2 Golden Apple Awards, the Students' Excellence in Education Award, the American Medical Student Association Service Award, the Paul C.J. Sun Dedicated Faculty Award, 2 Medical Student Affairs Council Distinguished Teaching Awards for Excellence in Education, 3 Medical Student Affairs Council Awards for Excellence in Preclinical Education, and 5 Medical Student Affairs Council Awards for Excellence in Clinical Education. Dr. Salzer, this is the third time that Dr. Salzer has been honored as an investiture marshal. He was also chosen by the classes of 2000 and 2003. Congratulations, Dr. Salzer. This is an important occasion and a joyous one, so please feel free to applaud. As members of the class of 2013 receive their doctoral hoods and diplomas, families, friends, and other well-wishers are encouraged to help make this moment a memorable one. Are we ready? So let's go. Dean Hall, honored guests, ladies and gentlemen, on behalf of the faculty of the School of Medicine, it is my privilege to present to you the members of the class of 2013.
So it's my real pleasure and my honor to be the one to read the names of the graduating class of 2013, our students, and soon to be our colleagues. Would the first row please approach the stage? Teresa Backus. Scott Bartkowski. Keith Basler. Whitney Beck. Gregory Blair. Shelley Bridgeford. David Calcara. Nicholas Castleman. Jennifer Crouch. Maxie Dark. Kelly Dawson. Sarah Marie Ditch. Craig Dunseth. Ellen East. Jessica Ellis. Erica Embry. Angel Jaime Enciso. Eric Ewing. Lawrence Feigenbaum. Jacob Feldhaus. Rebecca Fish. Michael Fuge. Kendall Gino. Elizabeth Gorby. Jayashri Gowda. Molly Greenwade. Bridget Gruender. Tyler Hayden. Taylor Ann Hahn. Autumn A. Hahn. Salma Hanif. Brendan Harris. Adam Harold. Brett Hazen. Brian Hilliard. Rebecca Hogg. Amanda Hopkins. Stephanie Irwin. Andrew Jackson. Alexandra James. Tyler Jenkins. Dana Ray Jett. Neil Jiwanlal. Jason Kern. Sarah Kesterson. Faiza Khan. Rula Ayad Kreis. Kristen King. Christine Carl. Nicholas Lefevre. Lucas Lenchi. Stacy Marie Lenga. Bo Liu. Alicia Catherine Ludden. Kyle Gerard Lukey. Daniel Adam Lyons. Kelly Mackenzie MacArthur. Amanda Justine McCambridge. Maya McCormick. Magda Dennis Miller. Jeffrey Lee Millis. Megan Marie Morman. Jennifer Moore. John Morrison. Samantha Knoll. Tara O'Connor. Corey Offit. Zachary Evan Panfili. Andrew Patel. Lindsay Marie Pegler. Lacey Ann Reeves. Janelle Riley. Sarah Whitney Robison. Michael Ruff. Nicholas Peter Ruthman. Ali Sharif. Nicole Shen. Drew Shinneman. Jack H. Short. Audrey Southard. Jeremy Stanek. Moselle Stark. Julie Stortz. Gina Swingle. Danielle Tata. Rose Ticey Wong Todd. Suman Vardy. Andrew Valeroy. Noah Wald Dickler. Audrey Wallace. Jason Warnicky. Alexandra Weir. Matthew Whithouse. Shannon Whitty. Lucy Young Hornberg. Sheena Yin. And Daniel Elise Zimmerman. Ladies and gentlemen, MU School of Medicine, class of 2013. Congratulations.
So I'll ask the class to rise one more time here so I can give you an important message. With the authority vested by the Board of Curators, it is my privilege to now formally confer upon each graduating senior the degree Doctor of Medicine with all of the rights and privileges pertaining thereto. Congratulations, class of 2013. You may be seated. Yesterday, the School of Medicine held its annual honors and awards convocations. Many of these graduates were honored at that convocation, and I hope that their family members were present to enjoy the moment. Your program today includes a list of all of yesterday's award winners, and I would invite you to review that. It is our tradition, however, to reserve for commencement some very special awards that I will now announce. First, the Dean's Award for Outstanding Achievement in Academic and Clinical Proficiency. This award is given to the student with the best academic record throughout medical school, and this year the award goes to Dr. Nicholas Lefevre. Please come forward. The next award is the Holt Leadership Award. This award is provided by two alumni of the School of Medicine, Drs. Jean and Richard Holt. Dr. Jean Holt is a faculty member at the University of Texas in San Antonio. Dr. Richard Holt is Executive Vice President of the American Academy of Otolaryngology in Alexandria, Virginia. This award is presented to the graduating student who has best exemplified the highest moral, ethical, and leadership traits and who has served as a peer role model. This individual has served in a leadership role in student organizations and provided service to the School of Medicine and above and beyond the normal call. The award winner is chosen by Drs. Jean and Richard Holt from a list provided by the Faculty Awards and Scholarship Committee. And the award this year goes to Dr. Brian Hilliard. And the final award is the Student Leadership Award. This award is presented to a member of the graduating class who has been selected by a vote of his or her classmates on the following criteria: evidence of leadership qualities, peer acceptance as a potential leader in professional activities, a student who is a doer and one who characteristically assumes leadership in the formal day-to-day activities of the student community. This year, the award goes to Dr. Jeffrey Mellis. Now, to close the graduation ceremony, the class of 2013 have chosen Dr. Faiza Khan to make a few comments. Dr. Khan, please come to the podium.
Thank you, Dr. Hall. I'm relieved to hear I'm still a doctor, even though I almost didn't get a hood. All right. When I first found out that I was chosen to speak at commencement, especially following such amazing speakers as Greg, Kendall, and Dr. Havey, I experienced some of the same emotions as when I first found out that I was accepted to medical school. Pride, excitement, a little apprehension at the impending workload, and then suddenly an overwhelming sensation of fear and immediate regret. I hadn't written anything but learning objectives or patient notes in years, but I assured myself that I could apply the same skills that I had been trained to use in medicine for this as well. So, as I'd done throughout my entire medical education, I Googled it. And then I spent 3 hours Facebooking. But this brief exercise in literature review, as my classmates and I misleadingly call it, prompted me to think back on my time here at the MU School of Medicine. Although now we smile happily with diplomas in hand, I think I speak for most of my class when I say that the majority of these past 4 years have been dominated by varying degrees of anxiety. Our first year brought with it the fear of the unknown. Will I be able to handle the coursework? Will I be able to handle problem-based learning? Will I pass out in cadaver lab? Our second year was completely consumed by step 1 of boards, a dark time in our lives when we tried to study 20 hours a day and still be functioning human beings. P.S. Not so possible. But third year signaled the beginning of our clinical training, when we soon encountered the most terrifying thing of all, real-life sick people. There was also the terror of interacting with real-life doctors and navigating the hierarchy of a whole hospital system. Although that was somewhat mitigated by the semi-sweet realization that medical student is always at the bottom of the totem pole. Fourth year saw us jet-setting across the country for away rotations, residency interviews, and of course, Step 2 CS, where we all paid $1,200 to learn that we were English proficient. Thank you, USMLE. Still, we trudged forward to finally make it to this glorious day. Now, as I stand here having received my medical degree and therefore being expected to actually know things, I'm filled with a terror unlike any I have ever known. But in spite of that, as I look out onto this crowd, I'm comforted. In front of me sit my incredibly smart and incredibly good-looking classmates who have faced and conquered the last 4 years with me. For those of you who haven't seen them, the M1 labs are a series of windowless rooms locked in the basement of the hospital. Now, I can only assume that this was designed to keep us literally in the dark about the rest of the world so that we would all just give up and keep on studying. But in addition to that end, and the eventual psychosis that set in within a few months, it also fostered a sense of family among the class. And that sense has stayed strong every year since. For the past 4 years, we have learned together and studied together. We've sustained MedZoo, the free clinic, together, and raised thousands of dollars for children's cancer research together. We've eaten together, partied together, we've laughed together, and we've done basically everything together. But most significantly, together we have grown to become professionals and friends. It's impossible to face medical school alone, and with a class like ours, nobody has had to. I had the good fortune of having my best friend here in medical school with me, and I know for certain that I would have failed and or completely lost my mind without her. But no matter how deep, most of these friendships have been forged only for a relatively short amount of time. As I look past my classmates, I see this auditorium full of family and friends who have loved and supported us throughout medical school and long before. They're the ones who have made it possible for us to be here today, and the accomplishment we are celebrating is as much theirs as it is ours. In fact, my family at least deserves a medal or something for all the incoherent, sobbing phone calls my parents have had to endure, and all the angry, unprompted tirades my poor brother has been unjustly subjected to. But if these long-suffering men and women have stuck by us thus far, I think it's safe to say that they will be there, loving and supporting us as we start this next chapter in our lives. On July 1st, we begin our career as newly minted resident physicians. The hours will be long, the workload will be tough, and the food will likely be mediocre. But most importantly, the stakes will be very, very high. Today is our day to celebrate ourselves. After that, our focus must always be the patient. Behind me sits a faculty that puts the health and well-being of patients above all else, and whose commitment to that principle has shaped the education that they've bestowed upon us. It's our job now to continue to uphold that principle no matter where we go or what specialty we are in. And though that may sound daunting, it's actually a great gift. Medicine at its very core requires goodwill and love unto others, and it's that compassion that heals patients and fulfills physicians. When I first started medical school, someone showed me a fantastic quote by a very cheeky Englishman named James Bryce. He said that medicine is the only profession that labors incessantly to destroy the very reason for its existence. When taken in the most literal sense, he's actually right. But Bryce was a politician, not a doctor, and so he couldn't possibly have known that real medicine is not about curing disease, but about caring for people. Yes, we will write prescriptions and we will perform procedures, but more importantly, we will build relationships and hopefully impact someone's life for the better. As doctors, it is not only our duty, but also our immense privilege to be able to care for those around us, and that's what makes our profession so noble. As I look at my class, gathered here together for the very last time, I know that each of us feels the same, and so I'm honored and I'm overwhelmed to have been your classmate and to now be your colleague. Congratulations, class of 2013. I know we'll do great things.
I'm so happy that all of you could be with us here today for this event. I'd like to invite you all to stay for the reception, which will happen immediately after this in the atrium of Jesse Hall, and I hope to have a chance to chat with many of you there. Class of 2013, I give you my best wishes.